all his body just always bled, like the bed sheets were filled with blood. That placement made me reconsider nursing. Hi guys, welcome back to Nursing with Sarah. Today, as you can tell from the title, I'm going to be talking about my first ever placement and what to expect. So, fucking. But before you do that, please do subscribe, like, and comment down below any other videos you'd like me to do. So this actual video came from someone who asked me a question, and the question was, what was it like on your first placement? Like, what did you have to do? They were really nervous, they haven't done nursing before, they haven't worked in healthcare before, so they didn't really know what to expect. And so I thought, okay, this will be a nice topic, because a lot of people are going into their first placements now, and so you're probably thinking about all of this on your mind, because you're thinking, how's first placement like? My first placement was acute medicine. All the wards are grouped, so I was on acute medicine. There's like stroke ward, there's gynecology, there's a whole lot. You've got like community or like district nursing, you've got like a practice GP practice, and so yeah, I was on acute medicine, and my ward specialised in infectious disease. So like we have patients with like MRSA, HIV, tuberculosis, everything, literally everything and anything is on my ward. Yeah. And so it being my first ever placement, I was already scared. As you've heard from my first video, I was in banking for 6 years. So here's me, Sarah, been in banking for 6 years, been at a computer at a desk all my life. I don't do patients, I don't do physical contact. Even at the bank, I wasn't on the shop floor, I was in the head office, I was, you know, in the office. I have my caseload, I always deal with complex customers, I call them, I deal with their complaints, I deal with high value transactions. That was my domain. So imagine now coming into healthcare, where now you're actually meeting people, and you're meeting sick people, you know, people that are not well, people that are going through a lot of things. And I then had to learn how to show my emotions face to face, because I've always been able to do it over the phone. So like, you know, like if a customer's complain about something that's gone on, I have to be able to calm the situation down, resolve, problem solve, and all of that. But then in the hospital now, it's very different, because you're dealing with them face to face. There's a lot of things that, like, to me, I thought, oh my god, this is so icky, but you can't show that in front of a patient, you know. So my first ever placement now, it was for 4 weeks, 150 hours that I had to complete. It was, again, as I said, infectious disease, acute medicine. Personally, I was very scared, and the reason why I was scared was because, as I said, I've never been in this environment before. So being in the hospital alone scared me, but the fact that now I'm dealing with patients that have infectious disease scared me even more. Yeah. So, and the reason why I was even more scared is because, as I said, I've got 2 children, so I'm not prepared to get something and bring it home to my kids and family. I'm thinking, I've got people at home that I have to look after, or people that are in close proximity to me. So what happens if anything happens to me? What happens to my kids? What happens to my family? And so that was the reason why I was really scared. I didn't know what to expect as well. Again, because I've never worked in healthcare, I didn't know what it's like to be a nurse, really. I watch a lot of videos about like a day in a nurse's life, a day in my job, a day in a nurse. I watched all of them, but I felt like it's very different from you actually being there. So prior to my placement starting, luckily I actually had a lecture at St Thomas Hospital, and I thought, oh my gosh, let me go upstairs to the ward and just see how it's like. So I took the lift, went upstairs, got to the ward, and yeah, like, it's just very different. I mean, to be honest, I felt like, I mean, it was good to have us feel and see exactly where I'll be working for the next month. However, it still felt like I was going to visit someone, because I wasn't there like in my uniform. I wasn't there for more than maybe like 5-10 minutes. All it was is I introduced myself to the nurses there, the nurse in charge, told them that I'm going to be starting with them, and that was it. So you can imagine, like, you're not in your uniform, you're not actually working, you're not actually going to be there for that long, you're not dealing with any patients at that point, you're just literally dealing with the staff. And so it felt, again, as I said, like as if I was just going to visit someone in the hospital. So anyways, I then started my placement. Now, that placement made me reconsider nursing. So it was at that placement that I was saying to myself, I think I'm going to drop out. And the reason why I had those feelings was because I was like, I didn't think that this is what nursing was all about. So when I got there, I mean, I had a really nice mentor. My basic job, or my basic responsibilities at that time, was to make the beds, assist with personal care. At the beginning of the shift, I have to go around to all the bays, or the everyone had, because it's an infectious disease, most of the patients had their own room. There was only one bed that had 2 beds in it. Every other room was separate. Every other patient had separate rooms. And then we had another place that was for negative pressure. So that part, like, when they first told me, oh, it's negative pressure, there's a code to enter, and there's patients inside, there's like 4 patients inside, and it's like they're not with the ward, like they're part of the ward but they're not with the other patients, they are separated from everyone else. And I was like really scared, because I was like, oh my god, like what do they have that, you know, me going in. So like when I used to go in, yeah, I used to hold my breath. Because I'm thinking, I don't even want to smell whatever's in there. I was so scared. So anyway, and then I had to go to every single room as well and ensure that the oxygen is working. Yeah, like practically that was my job, my responsibilities. Observations, checking their blood pressure, pulse, respiratory rate, temperature, basically their vital signs. And the reason why it discouraged me from nursing was because, you know, like when you first think, well, for me, when I first thought of nursing, I thought of, you know, like medications and like more complex things. So I was already thinking, like, is this what nursing is about? Like, I mean, I know the role of a healthcare assistant, and I felt like what I was doing was more of a healthcare assistant. It's like, you know, helping people with personal care, changing pads and things like that. And I thought, is this what nursing is all about? Like, is this what I'm going to be doing as a nurse for the rest of my life, if I decide to do nursing for the rest of my life? And I thought, okay, yeah, like, I'm not sure I actually want to do this. As I said, I've worked in a bank for 6 years, so my thing was, I'm so used to being by the computer and not dealing with customers face to face, and I'm having to deal with patients. I'm having to change them, I'm having to bath them, I'm having to you know, like change the bed sheets. And I was just so over it. I was like, oh my gosh, like what have I gotten myself into? And then at that time they were like, oh, like you need to learn the fundamentals of nursing, you need to understand the basics of nursing. And I'm really grateful actually for that placement, because I feel like it made me appreciate the healthcare assistants a bit more as well. Because as a nurse, like now 2 years in, and I still do bank shifts as a healthcare assistant right now, and I think like it makes you value them more. It makes you understand that you're not just, whatever you can do to help a healthcare assistant, do it. It made me understand exactly what their job role is. It made me understand as well the basics of nursing, because nursing is holistic care. You can't be a nurse and not think about where the patient has laid their head all night, whether the patient is having appropriate personal care, are they clean, are they eating, drinking, and all of this aids them getting better. Nutrition aids them getting better, them feeling good, them looking good, smelling good. aids them getting better. So I really appreciate I now coming out of it, I appreciated my placement, because I'm thinking now I understand more of the holistic care. I'm happy that I didn't get straight into medicine management, you know, like literally like as a nurse. Like I'm just thinking like now, like it's a lot, you know, to be thrown into the deep end as a nurse on your first ever placement. So I think it was good to be able to warm up to nursing with that. So yeah, like it was really good actually. I enjoyed it. I got all my things signed off, you know, like when you're starting nursing they give you a PLAD, which is your practice assessment document. Anyways, when you're starting nursing they give you a PLAD, which is your practice assessment document, which you take to all your placements. I believe like most of the universities in the UK use the same one. So you take it to your placements. You have to have a patient that would give you feedback. You need to have let me show you my first ever PLAD. So guys, this is my first ever PLAD. It's your practice assessment document. Yeah, we had to write a reflection as well in first year. So you've got a list of all your mentors. At that time they were called mentors, now they're called practice assessors. They all have to sign. If you don't get a signature, you have to go back. That's long. So yeah, everybody has to sign. Anyone that touches this book, anyone that writes anything in this book has to sign the front cover over here. If not, you have to go back and get their signature, which I had to do at one point actually. So yeah, like the next page talks about where your ward is, how many hours you're doing, your start date and end date, your mentor details, academic contact details, and so on. Then you go on to do your orientation, which is like an induction. You'll do that at your placement. It'll tell you what to do if there's a fire alarm, tell you like resuscitation, if there was an emergency, what do you do, what number do you dial, what do you have to do, where the resuscitation equipment is, because a lot of times when there's emergency they kind of use the student. Like you just need to know where everything is. Shift time, meal times, how to report your sickness, information governance, safeguarding, loan working. Everything has to be said to you and they have to sign that you understand. Then you do your initial interview. So your initial interview is when you set goals for that placement. So for example, I had to set the most basic goals, which were, for example, like to be able to make a bed, a hospital bed, to be able to carry out routine observations and record them on e-noting, to be able to perform personal care and oral care in the bath and in bed. So you know, like some patients are not mobile, so you have to do a lot of things in bed. Oh my god, now that I'm thinking about it, yeah, I'm just remembering all the personal care that I did on this placement. It was hard, like, because again they got like, I feel I've got like dermatology problems, like so much was going on, and I was so scared because it was my first ever place. I've never seen anything like that before, and so I don't know, like there's so much. I remember there was one patient, like all his body just always bled, like the bedsheets were blood, filled with blood. It was so much. I felt so sorry for him, and you know, he can't, one of them could get into the bath and the other one couldn't, so you have to do like bed baths and stuff. But yeah, so anyways, you do your initial assessment, initial interview, you do professional values and practice, you do your midpoint interview. So halfway through your placement, mine was a 4-week placement, so in the middle, which is 2 weeks, we then review my goals. How am I going, and then set new goals, you know, because obviously you should have been able to accomplish those ones, set new ones for the rest of the placement. Then you do the final interview, and if there's any learning developmental needs, you have to get feedback from a patient. They have to actually give you feedback. How well did you care for them? Did you listen to their needs? Did you understand the way they felt? Did you talk to them? And did you show respect? and then you then have to do reflections of your learning, a lot of reflection, and then we have to get feedback as well from staff. That's the end of first placement. The next one is second placement. So yeah, like, don't be scared. If you're going into your placement now, one advice I'll give you is don't be scared. Take everything as slow as you can. Enjoy the moment. Learn as much as you can. Make sure you've got a notebook that you can write down stuff, little notes. Like when you do observations, I used to find it easier to write all the observations down and then go back onto e-noting and then begin to copy them all on there. And also, like, there's some things like, for example, like the key codes, this, like, you just don't know what is what. And sometimes as well, as you're going with your mentor, they might tell you some certain things that they're doing and you just need to take note of them. So I think it's really advisable to always have a little notebook that you can fit into your pocket. But yeah, like, ultimately, just take it easy on yourself, be patient. You're gonna learn a lot. It's your first placement, so don't expect much. That I can say to you, don't expect much. Don't think that you're going to be doing the whole medicine and the this and that, because it's the first placement is more of teaching you the fundamentals of nursing. They know it's your first ever placement, so they're not going to give anything too hard, too stressful. Enjoy it, learn through it, ask as many questions as you can. I mean, always have questions that you can ask your mentor. Always ask questions that you're not sure about. You know, you're always going to be going around with a practice assessor anyway, or your mentor, so you're going to see what they're doing. Try to understand, you know, because when you're coming into nursing, you're trying to understand the illness and the pathology. So you're trying to understand, why is this person sick? Why is it affecting them in this way? What organ and what is it that is making them feel this way, or making them be sick, or whatever it is. So ask as many questions as you can, because you're going to have anatomy and physiology, and it's so important. Like, it's so helpful when you learn the theory at uni and you can remember what's happening in practice. Like, oh yeah, like, oh my gosh, like, I had a patient like that, and I remember my mentor saying, you know, this is what was wrong, and this is the organ it affected, and when it affects that organ, this is the symptoms, and this is what happens, you know, and all of that. So ask as many questions as you can. You could also ask about medications as well, even though you're not given medications. Again, you're going to be doing pharmacology, and so these little things, when you can ask and they can break it down to you and explain to you. I hope I was able to answer as much questions as I can. I hope I was able to give an insight as to what your first ever placement will be like as a nurse. Bear in mind that this is a placement in a hospital. You might be in a community, and so it'll be very different. As I said, I was in acute medicine with infectious disease, and so this was my experience there. Yeah, like, comment down below if you've got any questions, or you want me to clarify something, or any other ideas for videos you would like me to do. Please do subscribe, like, and follow me on my socials as well. Thank you so much for your love. Thank you for watching. Bye.